Good afternoon, everyone. Thanks for joining us on the news briefing for this Wednesday. We will get started with our COVID-19 information. I see we have Dr. Moreno with us this afternoon. Good afternoon, Dr. Moreno.
Hi, ma'am.
I have some questions already, and then if there are any other questions, please go ahead and put them in chat, and we'll go ahead and get started. Dr. Moreno, health officials have been warning about a possible trifecta of COVID, flu, and RSV for the past few weeks. Has that come to fruition?
Thanks, Matt. So we are still concerned about COVID-19, and so we're still recommending that people get vaccinated against COVID-19 when they're due for a booster. This winter, we are seeing the typical respiratory viruses that we see when we're not experiencing a pandemic, such as we're experiencing the COVID-19. So in typical years, we see an increase in RSV, and we have an increase in RSV. We see flu, influenza virus, and we do see some influenza virus activity locally as well. And there are other viruses that we are experiencing, we're seeing as well, that can also cause symptoms that are similar to COVID-19. I think it's important for people to know that it's very difficult. It may be difficult to tell the difference between COVID-19 and other respiratory viruses that are causing respiratory illnesses. So again, it's really important for people to get vaccinated against COVID-19 to reduce the likelihood that that person will come down with respiratory illness and miss out on work, school, or other family events.
Thank you, Dr. Moreno. Next question. How much has this, and referring to the trifecta that you were just discussing, how much has it taxed the healthcare system, and in what specific ways?
Yeah, that I do not know.
Thank you. And next question, are children being especially hard hit?
Let's see. So we're really focusing right now on COVID-19 because that's the one illness that we can prevent with a vaccine. And so again, it's really important for parents to get their kids vaccinated against COVID-19 and any other illnesses that can cause respiratory illness, such as influenza, which we also have a vaccine for. So really important for people to get their kids vaccinated against COVID-19 when they're old enough, and also against influenza.
Thank you, Dr. Moreno. That is all the questions I have at this point. Are there any additional questions for Dr. Moreno for today? And giving it a minute here. No more questions for you today, Dr. Moreno. Thanks very much for taking part as usual.
Of course, thanks.
And we're going to continue the discussion on respiratory illnesses. We're very pleased to have with us Dr. Sarah Smith from Natividad. Dr. Smith, you just heard Dr. Moreno talking about, the response to concerns about this trifecta of respiratory illnesses. I'm hoping you can share what you're seeing at Natividad, and then what's some good advice for people to try to protect themselves and children.
Yeah, definitely. So at Natividad, we've been seeing a lot more children with respiratory illnesses. In the last 2 to 3 years, the kids have all been very isolated and at home, which, there's so many problems with that also, but they have not been spreading all their usual viral illnesses to each other. This year, however, we've got everybody's back at school, which is great, and they're socializing, but they are also spreading all the usual respiratory winter viruses. We have a group of kids between the newborns to about 3 who've really been unexposed to everything for their entire lives, right? So now this is the first winter where they're hitting all of it, and their school-age siblings are back at school and they're bringing things home. So we're seeing a lot of kids that come in with multiple viruses. We're not actually seeing a lot of actual COVID-19 in the kids. It's more RSV, influenza, parainfluenza, human metapneumovirus, adenovirus, just all the usual viral vectors, but the kids are all just getting sick with it. And often we'll have kids admitted that have 3 or 4 of those all at the same time, which I think is just, a natural process of, we didn't do anything for, we had 2 or 3 years of, there were no kids in the hospital, and now we're seeing a lot of kids. let's see, we've got a lot of high acuity. And again, I think that goes along with just kids that have multiple things, which goes back to just, good hand washing. And if your child is sick, not sending them to school, don't go out, don't go to the supermarket with your sneezing child, because they are just spreading all sorts of different things all around. As far as the hospital, we've had a fair amount of inpatients. We've had a lot of high acuity. I think in the last 2 weeks, we think we were trying to count it up. We've had about 25 PICU transfers, which is a lot, I mean, that's in 14 days, is, at least more than one a day of the children that are critically ill and need higher respiratory support. The entire state is the same. When we've been looking for beds for these patients that we think are at ICU status, we've had to wait up to 36, 48 hours waiting to get an ICU bed. And we're able to manage the kids in our ER because the ER can do critical care, and which is great. But it's something we haven't seen in a long, long time, where we're looking from, so we're in Salinas and we're looking from San Diego up through Sacramento out to Las Vegas, and there's literally no bed. Which is, just shows everybody's kind of seeing the surge of illnesses. What else? It seems like it's settled down over the last couple of days, seems a little bit better. We'll see how things are after Thanksgiving, once everybody spreads their little germs around to each other again, but we'll see. But yeah, I think it's a lot of the same stuff. People can get their influenza vaccine, get their COVID vaccines, wash their hands, don't go out if you're sick. It's kind of the bottom line. And as far as our ERs are seeing a lot of surge also, as far as just a lot of respiratory patients. There really isn't a treatment for most of the viral illnesses that the kids have. I mean, we can do Tamiflu for influenza, but other than that, it's mostly supportive care. So trying to hydrate kids, suck their noses out, let them rest, let them stay at home. And then if they do seem to be having trouble breathing, so like breathing really hard, deep retraction, sucking under the ribs, those are times they should definitely come into the ER, or if they can't drink enough.
Thank you, Dr. Smith, very much. This must be a really scary situation for the parents and the families that you deal with, especially waiting. You're talking about looking for a bed. If you happen to have a child who's in this situation, how do you assist the parents as well as they must be frantic?
Yeah, it's really hard. It's, I think reassuring the parents that we can provide them the care, and thus far we've been able to in the ERs, like keep the children stable, but it's scary. And then a lot of our patients, it's a stress to even come from Greenfield up to Salinas, right? Let alone we're going to ship their child in a helicopter to Reno, which just is a huge tax on any family. So it's hard. Most of our kids have been doing well, and we've had several that actually were holding for PICU beds for several days, and they actually got better enough that we were able to admit them to our acute care unit, and they actually eventually went home, which was good. I mean, it's not the usual model of care, but we've been joking.
Well, win is a win, right?
Yeah, exactly. Yeah. No, we joke we have our ED PICU, but yeah, no, it is. It's a big stress on the families and the patients and everyone.
So you were talking about the kids going, having been isolated for a while, and then, going back to school, and then we're, seeing the resurge of all the usual germs, plus these other, more potent viruses. We had masks kind of in to help with that. Now it's more your choice mask. What can you tell parents and families about, people may not want to wear a mask anymore, but maybe this is a better choice.
Yeah, I think, obviously the little kids, and if you're having a hard time breathing, you shouldn't be wearing a mask. But, if you've got a 5-year-old and you have to be walking through a store and they've got a cold and they're sneezing, it's probably a good idea to put them in a mask just to prevent transmission. And it might be a reasonable choice to wear a mask, especially when you're in a high population area. Like if you're in a very crowded room, you're going to be like, say, at church on Christmas Eve, and there's a lot of people around, that might be the time. As far as the kids go, they're sicker than they've been in years, just because they're back out there and all the viruses back out there. And this is, normal. I mean, kids usually will catch all these viruses before they're 5. But I think they're just kind of having it all in one year. It's the problem.
So if we look at Thanksgiving as last week, and if you project ahead to what you may be seeing in Natividad, when would you be expecting to see some, if there's going to be a surge from Thanksgiving, when would you anticipate seeing it?
I'd say probably anytime from here out through this weekend. I think we'll start seeing more. Today actually was a relatively mellow. We've got 2 kids waiting for ICU transfer in the ER, and we've got 3 on the floor. But it's definitely not as overwhelming as it was a couple of weeks ago. So hard to say.
And any additional good advice for families who are, they may have gathered, or they're looking forward to gathering at Christmas, or they're going to go out and do Christmas shopping? What advice would you give adults, children, as far as trying to stay safe from these respiratory illnesses this season?
I think probably just encouraging people that are sick with anything. So it's so hard to differentiate which virus you have, right? So everybody has, they have a sore throat or a runny nose or little aches and pains. And when we test the kids, we have this long respiratory panel that shows up with whatever everybody has. And it's like 15 different viruses. And it's interesting because there's so many of them that people are positive with. So I think if anybody is sick with anything, like if you have a cold, you have a cough, you should probably just stay home and just, give your family the grace to say, well, it's okay this year to just avoid the gathering and avoid spreading everything around, because even if somebody else has had a cold, it might be a different type of virus, which is what we're seeing in a lot of the kids, is that they had a cold and then they got a worse cold. And so they have these fevers that go on. And it's just that they're getting virus after virus after virus. So I think if you're sick, just stay home, wash your hands, probably wear a mask.
Thank you so much for being here today and sharing really good information. And we're going to keep our fingers crossed for good results for the patients that you have in-house right now.
Great, thanks.
Thank you. And then our final topic today, some of you may remember the County of Monterey broke ground on the Alisal Integrated Health Clinic back in May. This clinic is going to give local adults and children better access to mental health services, and we're going to check in on the project. We're very pleased to have Dr. Marni Sandoval. She is Deputy Director of the County of Monterey Behavioral Health Bureau. Good afternoon, Dr. Sandoval.
Hi, good afternoon. Thank you for making the time to have me join you today. Happy to share a little bit about our project. I tried to put some graphics up there on the screen. Did that work? Okay, perfect.
Yeah.
I just wanted to share a little bit of information about our project. As you indicated, we did break ground in March of this year. So here's just a little information about the various folks involved in the project, many departments coming together. Just a little bit of background. It was about 8 years ago that the idea around this project began. It started with discussions around the goal of bringing more health services to the Alisal community, and a county and city land swap occurred for a piece of property that was prior occupied by a faith-based organization. And so as that land swap occurred, planning began for bringing an integrated health center to this area of our community. The site itself is located on North Sanborn near the Circle Drive intersection. You can see on the map there, it shows you a little bit where our site is located. And then the project information, it'll be a 2-story building. There's a nice rendering here from our architect about what the building will look like. The first floor will be 9,593 square feet, and we'll have medical offices and exam rooms on the first floor, as well as family and group treatment rooms for behavioral health, specific children's therapy rooms, a really nicely situated occupational therapy room, and then we'll have a large multi-purpose and community meeting room. And I'll talk a little bit more about that in a moment. Then on the second floor is where the bulk of our behavioral health staff will be housed. We'll have specific offices for Although there'll be 33 offices, they'll be occupied by 2 to 3 staff. Not at the same time, you know, we will have people rotating. This facility will serve as a really nice home base for our behavioral health staff to be out in the community and in the local schools, which is the work that we're doing on a regular basis. And now they will have a more centralized home base for that. And then we will have a nice parking area with 83 parking stalls. This is just a variety of the services that our Behavioral Health Bureau will be providing out of the facility for our Medi-Cal beneficiaries in the community that do have mild to moderate mental health needs. And then I wanted to really highlight how this work, as I mentioned, the plan initially was to bring more health services to the Alisal community. And so this project really supports the City of Salinas Alisal Vibrancy Plan. The goal within the plan is HS5, and the intent there is to expand access to culturally competent medical and mental health services. And so our facility will be bringing mental health services to East Salinas, provide access to children, youth, and their families. We're very excited about this. And then it will also house, as I mentioned, the health center as a overflow for Alisal Health Center for same-day services. This is just a blown up graphic of the multi-purpose and community meeting room that will be on the first floor of the facility. You'll see that little arrow there highlighting the exterior access entrance to the multi-purpose room, because our goal and intention is really to have this space available to the public for organizational meetings and events when it's not in use by the medical and behavioral health staff. And that will include after hours access for all of the needs that folks in the community might have. So we're looking forward to be able to provide that space to the community. Our project has been moving along. So as I mentioned, in March of 2022, this year we did break ground. So you can see the picture there in the far bottom right was our initial site. By September, we had a bit of a structure emerging, and then these are some recent pictures that the team took in mid-November. Really, the building is starting to take shape. So the project continues to be on schedule. There have been some periodic road closures in the area, and those have been related to sewer line installation, which is now complete, and power installation, which is still in progress. So there may be some additional periodic road closures, but we're hoping to have that completed soon. The goal of the project, construction will continue through 2023 with anticipated building occupancy in early 2024. So that is what I wanted to share with everybody today.
That is so exciting to see the building come up. And I know we've been doing the road closures, you know, letting people know about those road closures. So there are a lot of interest in seeing when it will happen, when this will finally be ready to go. I wanted to ask you, it's really a great expansion of services. In your opinion, what are the greatest needs of people who are going to be able to access this building, have it so close by in an area that really, it wasn't necessarily underserved, but it had difficulty accessing or having easy access to services?
Yes, absolutely. And really a primary benefit here is creating easier access to folks in the community. Our hope is that they will be able to easily walk to the facility if transportation is an issue for them. We purposefully located it close to a bus stop so that if people are accessing public transportation as their mode of getting around, that would be an easy thing for them to do and access this facility. And then we also will really, again, be able to have this facility as a central location in this community so that our staff will not necessarily have to be limited to seeing and providing services out of the facility, but they can use it as a home base to then be out in the community and providing those services in the schools and in homes. We do a lot of home-based care for many of our programs to support families, and we're hoping we can do more of that, having this center located here. Additionally, I'm sure it's come up in many conversations you've had in these briefings, and people are probably hearing conversations even in mainstream media that we really are seeing a mental health crisis of proportions we've never experienced with our children and youth. And so to be able to have this facility accessible for the families in this community, we're hoping that it will encourage them to not feel like they're alone. Behavioral health is here to support everybody through this difficult time and to provide the care that people need. And even if it's something that feels like it might be small and you shouldn't reach out for help, that's often the best time to do it, because professionals and we have parent partners and family partners that can help when things are more easily to have early intervention and prevent things before they become bigger challenges. And so really the goal is to help families be as healthy as they can. So we're hoping that this will do that.
Well, and we don't want people to wait until the building is finished to reach out for help. If
Of course.
people need assistance right now, what would be the best way for them to reach out? And I know there are various levels, maybe online, maybe in person. What would you recommend to people who are seeking assistance?
The best thing to do is call our access line, and I can get that number and put it in the chat for you. But we have our 24-hour behavioral health access line. People can call that number and then it will be responded to, and they can share what it is they're concerned about or what information or need they might be seeking assistance with, and they'll be directed in the right place depending on what their particular need might be. So that really would be the ideal thing for people to do. And they can do that anytime.
Something you mentioned earlier, talking about a staff assistance in the schools. I'm wondering if this is a really great expansion of children who are returning to those classrooms, having been through the stress of the pandemic. How, what are ways that behavioral health can assist children in the schools, or ways of programs that you have?
So we have a pretty long time established partnership with our Monterey County Office of Education. I'm just putting the toll-free line in the chat for you right now. It's 1-888-258-6029. That's for our behavioral health access line. So you can call that anytime for help. But our school-based services, we have a long-standing relationship with the Office of Education, as well as all of the 24 districts throughout the county. We provide supports, of course, for students who are having mental health needs as part of their IEPs, but in many of the districts, we're also providing support for the general population of students in partnership with district leadership. And so we have staff that are on campus every day of the week providing behavioral health supports. So if parents are feeling concerned about their children, they can reach out to school administration on their school site and ask about mental health support. And the school staff there at their local school site will be able to help direct them to whether it's school-based staff that are hired and providing that support to their students, if there are behavioral health staff that are on campus providing that support, or if they need to provide information to, again, send them to our access department to help them get the support that they need. But don't wait. The schools are there in partnership with us to really help the students have what they need to be successful in their education and to catch things before they become more significant.
Thank you very much, Dr. Sandoval, for this update. It's really exciting to see, the new building go up, but the symbol of what the building is and the accessibility and what will be provided in the community is so exciting. And so we're going to have to check. We're going to have to check back with you in about a year from now for when you have your grand opening.
Absolutely. That was the next thing I was going to share you. As we continue to make progress, we'll start to be able to have an idea of when we will have our opening celebration and be excited to welcome the whole community to come and see the facility.
Thanks again for the information, and thanks everyone for joining us on the briefing this week. Our next briefing is next week. We'll see you then.